This program is rated SPG. It contains scenes with themes, language, violence, sex, horror, or drugs, which may not be suitable for children. Strong parental guidance is advised.
Maayong buntag, Mindanao. My name is Alex Francis Emoyang, and for today's news, we are going to talk about the sexual behaviors. For that, let me read the objectives of this news. So the first one is that to discuss the variety of sexual behaviors in humans. The second one is to tackle atypical sexual variations. And the last one is to show appreciations of the diversity of human sexual expressions. So we have here the definition of terms. We have here the sexual behavior, the erotic, the sexual response cycles, the sexual dysfunction, the copulatory behavior, and the last but not the least is the paraphilia. In earlier discussions, we mentioned that psychology has three primary components: the affect, which is the emotions and feelings, the cognition, which is the thought process, and the behavior, which is the actions. Hence, when we use a framework in understanding human sexuality, it is only appropriate to explore the diversity of behaviors relevant to our understanding of human sexuality. So what is behavior? In simpler terms, it refers to action. So these are the things that we do, both overt or observable, and covert or not readily observable by our naked eye. So on a daily basis, we act because of motivation. So motivation, something that drives us to do something. Some psychologists believe that we behave because it is our response to stimuli. Others believe that we do things because we want to achieve pleasure or avoid pain. Some think it is because we want to achieve a goal towards the fulfillment of our potentials and aspirations as a human in search for meaning. So what is interesting about the behavior, it is readily measurable as opposed to feelings and thoughts. You can look at its frequency, how many times an action is done in a span of time. So you can also check on the duration. So duration is that how long does an action takes place, say in a seconds, minutes, or hours. So a behavior has an intensity. So intensity is the magnitude by which it is done. Is it forceful or is it weak? So then there is diversity. So diversity is that what are the varieties of similar behavior is done in a various contexts, or what are the different behaviors we are capable of depending in or our physical characteristics. So that would be all for today. Thank you.
Hi everyone, good morning. This is Regine and I'm going to tackle about sexual behaviors. In this topic, I'll be saying sensitive words. That is why I am asking you to please be open-minded. So here we go. Before anything else, we need to identify first the definition of sexual behaviors. Sexual behaviors are actions that humans agree to interpret as an expression of their sexual motivations or intentions. It is also important to remember that behaviors are given meaning by people. In addition, sexual behaviors are generally erotic behaviors, which involves any of the primary or secondary erotic zones. When we say erotic behaviors, it is likely more on sexual love or sexual desire. When we also say erotic zones, it refers to our body parts which are erogenous, such as our face, neck, genitalia, and chest, or any other private parts that human has. Sexual behaviors can be typed according to the aim of the behavior. In this topic, we will be classifying three classifications of sexual behaviors. We have here the three classifications of sexual behaviors. we have autoerotic behaviors and homoerotic and heteroerotic. So let's discuss first the autoerotic behavior. Autoerotic behavior is a self-directed sexual behavior because it is the stimulation of one's own genitals, by which actions is only done by one person or by the person itself. The example of this one is masturbation. We also know that masturbation can also be done by a girl or a boy. That is why it is called a self-directed, because the action is only done by the person itself and it doesn't include other people. On the other hand, since we have self-directed sexual behaviors, we also have sexual behaviors that is not self-directed, and these are homoerotic and heteroerotic. These behaviors comes with erotic motivations, and when we say erotic motivations, it refers to the person who wants to feel the pleasure of having sex with other people. So let us now discuss their differences. Homoerotic behaviors are sexual behaviors oriented to the same sex. These behaviors are done by two partners that has the same sex, and like for example, two women or two men. While heteroerotic behaviors are sexual behaviors oriented to the other sex. These behaviors are done by two people with opposite sex, such as a girl and a guy. Those sexual behaviors are identified according to the sexuality of a person. But it doesn't just end there. Do you know what is a copulation? Copulation is necessary for reproductive purposes. It is the insertion of the penis of a man to the vagina of the woman. It is also known as a sexual intercourse that is done only by a man and women. Since the purpose of copulation is to reproduce, we also have two positions in this process. We have ventral position and ventral dorsal position. When we say ventral position, the ventral here is our abdomen, or also called as a ventris. The male and female species are facing each other, not just their species, but also their faces, and their body is facing each other. It is also known as a face-to-face position, and in general term, it is also known as a missionary. We also have this other position, which is ventral dorsal position. The dorsal here is our back, or in other term, it is a dorsum. If we have a face-to-face position, we also have the opposite one. It is assumed that in a ventral dorsal position, the abdomen of the male species is facing the dorsum of the female species, or the vagina of the woman. It means that the insertion of the penis is from behind. In general term, or in the societal term, we also call this one as the dog style. So to understand this clearly, these positions are only applicable to a heteroerotic behaviors, which is done by two people with the opposite sex. To wrap this out, the ventral position is known as the missionary, and the ventral dorsal position is known as the dog style. Since we have discussed the positions in the process of copulation, we also have non-copulatory sexual behaviors. Non-copulatory sexual behaviors includes hugging, kissing, and caressing only, and it doesn't include any other sexual intercourse. Since non-copulatory sexual behaviors doesn't include the insertion of penis, we have this oral stimulation of genitals, which means that the genital is being stimulated through the use of the mouth. We have three classifications of this one. These are fellatio, cunnilingus, and anal sex. The oral stimulation of genitals can be done by any type of sex. It could be the man and man or women and women, and it could also be a men and women. So let us now discuss their differences. The fellatio is the oral stimulation of the penis, or what we call as blowjob or BJ. However, cunnilingus is the oral stimulation of vagina, or what we call as the eating of the pussy. And the last one is the anal sex or the anal sex. There are also a sexual behaviors that involve stimulation or penetration of the anal orifice or the anus. In addition, if we have simple terms or simple words to refer fellatio and cunnilingus, we also have anal sex. In anal sex, palubi is the term most people use to identify the method of anal sex. So to summarize, in copulatory sexual behaviors, we have two positions in this one, and the non-copulatory sexual behaviors, we have three types of oral stimulations, which are fellatio, or also called as blowjob, and the cunnilingus as a eating of the pussy or the anal sex or palubi. So that is all for my news topic, which is about sexual behaviors. I hope you learned something from the terms I have discussed. Once again, this is reporter Regine, and let us now hear from the next reporter.
Thank you, Reg. And now for our breaking news. The sexual response cycle. Every person must know the changes of our body when doing sexual intercourse. The sexual response cycle is in both human male and female undergoes a sequence of bodily changes which prepare them for the sexual climax. Now, in sexual response cycle, there are 4 phases according to Masters and Johnson. Now, the first phases is the excitement. In male, the beginning of the excitement phase is observed when the penis becomes partially or fully erect, often only a few seconds of erotic stimulation. The erection may be partially lost and regained repeatedly during the extended excitement phase. Both testicles become drawn upward toward the perineum, notably in circumcised male where less skin is available to accommodate the erection. Also, the scrotum can tense and thicken during the erection process. In female, the excitement phase can also from several minutes to several hours. The onset of vascogension results in swelling of the woman's clitoris, labia minora, and vagina. The muscle that surrounds the vaginal opening grows tighter, and the uterus elevates and grows in size. The vaginal walls begin to produce a lubricating organic liquid. Meanwhile, the breasts increase slightly in size and nipple become hardened and erect. In plateau, during this phase, the male urethral sphincter contracts so as to prevent urine from mixing with semen and to guard against retrograde ejaculation, and the muscles at the base of the penis begin a steady rhythmic contraction. Males start to secrete seminal fluid or pre-ejaculation fluid, and testicles rise closer to the body. The plateau stage in females is basically a continuation of the same changes event in the excitement stage. The clitoris becomes extremely sensitive and withdraws slightly, and the Bartholin glands produce further lubrication. Tissues of the outer third of the vaginal swell, and the muscle tightens, reducing the diameter of the opening of the vagina. Masters and Johnson refer to the changes that takes place during the plateau stage as the orgasmic platform. For those who never achieve orgasm, this is the peak of a sexual excitement. Now the remaining phases will be explained by my co-reporter, and I am Rinaldo Pascual. Thank you and have a great
Good morning, everyone. To continue the report of Reynold, I am Johnny Lu Ortiz, and this is my report. Orgasm. The orgasm phase is the climax of the sexual response cycle. It is a stage of release wherein the human male achieves ejaculation and the human female is ready to receive the sperm for possible fertilization. In the human male, ejaculation is made possible by the contraction of the vas deferens, seminal vesicles, and urethra, followed by the contraction of the rectal sphincter. In the human female, the vagina, uterus, and the anal sphincter also contract. So next is the resolution. If you look at the picture, it clearly describes what is resolution. So the male penis returns to its normal unerected phase, whereas the testes and the scrotum descend. In the human female, the outer and the inner reproductive organs also react. So next is the Kaplan's model. Unlike Master and Jonas' model, like in the Reynolds report, Kaplan's model sees the sexual response cycle as having relatively independent stages. So there are three phases of this model include desire, arousal, and orgasm. So first, the desire. Desire is the psychological component of the sexual response. It involves sexual thoughts and feelings, which are necessary for a satisfying sexual experience. However, desire does not necessarily translate into action. So next is the arousal. It is the physiological component of sexual response, wherein bodily changes occur as outcome of sexual stimulation. Just like desire, arousal may not necessarily translate into orgasm. So lastly is the orgasm. Orgasm in Kaplan's model is generally similar with that of Masters and Johnson's model, except that this phase also includes the resolution phase. In Kaplan's model, orgasm is the completion of sexual response. And that's all for my report. Apple Pulikit, take it away!
Hello everyone, I am Apple Pulikit and I'm going to report sexual dysfunction disorder. So first and foremost, let's talk about the contents of this report. So first we will going to talk about the definition of sexual dysfunction. The next one is the causes of sexual dysfunction. The third one is the 4 categories of sexual dysfunction. And lastly, the treatment strategies of sexual dysfunction. So what is sexual dysfunction? So sexual dysfunction is a problem that can happen during any phase of sexual response cycle, and it prevents you from experiencing satisfaction from sexual activity. So now let's proceed to the causes of sexual dysfunction. So the origin of sexual dysfunction disorder are varied. This means that there are different kind of reason why sexual dysfunction disorder occur. Because some people experience difficulty or problem in some of the sexual spaces. So the second one, it can be organic. Problem with anatomy and physiology of reproductive organ. And it can also be psychosomatic, whereas a physiological concern which manifests physically. So the third one, there are also a gamut of interventions that are either biomedical such as surgery or medication, and psychosocial such as psychotherapy, education, marital or couples counseling. So the next one, we will going to talk about the 4 categories of sexual dysfunction. So sexual dysfunction generally is classified into 4 categories. It is the sexual desire disorder, sexual arousal disorder, the orgasmic disorder, and lastly, the sexual pain disorder. So, sexual desire disorder. It is when an individual has low levels of desire or has an aversion to sexual activities. So, in this case, the person has a lack of sexual desire or interest in sex. So the second one is sexual arousal disorder. It is when an individual has problems in achieving necessary physiological state for copulation, such as erectile dysfunction in males. So at this case, the person might have experienced an inability to become physically aroused or excited during sexual activity. The third one is the orgasmic disorder. It is when an individual has problems in achieving orgasm, such as premature ejaculation among males and female orgasmic disorder. So at this case, there is a delay or absence of orgasm. So the last one is the sexual pain disorder. It is when there is an experience of pain during the sexual response cycles, such as painful erection or dyspnea and vaginal spasm or vaginismus. In this case, there are pain during intercourse that leads to sexual dysfunction. So now let's proceed to how is sexual dysfunction treated. So most type of sexual dysfunction can be addressed by treating the underlying physical or psychological problem. And there are also other strategies that would treat sexual dysfunction, such as medication, mechanical aids, sex therapy, behavioral treatments, psychotherapy, and education and communication. And that's all for the day, and thank you.
Hey everyone, I am Livda Pangaya, your reporter. So today the breaking news is all about the paraphilia. So while there are typical sexual behaviors among humans, there are also those behaviors that are relatively atypical. They are atypical due to any of the following reasons. First, they are not prevalent. Second, they are dangerous to self and to others. Third, they are bizarre and they are not socially acceptable. And fourth, they are distressing either to the doer or to the other involved in the act. Among these atypical sexual behaviors, variations, which is also considered by the APA as disorder, is paraphilia. So, what is paraphilia? Paraphilia is when an individual gets sexually aroused by an object, a person, or a circumstance that are unusual. Example, pain-inflicting, humiliating, non-consenting persons. So what is a paraphilic disorder? A paraphilic disorder is when the urge or act lasts for at least 6 months and its manifestation of clinically significant distress. Some of the common paraphilic disorder are as follows: exhibitionism, pleasure from exposing one's genital to non-consenting people; fetishism, arousal from non-living objects, examples shoes, socks, and body parts; fruitourism, touching or rubbing one's body or genital to non-consenting people; pedophilia, arousal from children or pubescent; sexual masochism, arousal from actual suffering or humiliation; sexual sadism, arousal from actual inflicting pains to others; transvestic fetishism, for heterosexual males only, arousal from wearing clothing by the opposite sex during sexual activities; and voyeurism, observing other people engage in sexual activities. So, always remember that for a paraphilia to be considered a paraphilic disorder, diagnosis has to be made. Only trained psychologists or medical doctors can make such clinical judgment after lengthy and comprehensive assessment. So that would be all. Thank you for listening.